Hi, everyone. Good morning, good afternoon. My name is Eric Bolesh, and I am the Chief Operating Officer here at Cutting Edge Information. We have some more attendees trickling in, but I was going to get started with some housekeeping points here before we get into the true findings, the true content of today's session. So I hope you're having a good day so far. I hope everyone's staying safe and staying healthy. We want to make sure that everyone can see and hear, of course, and Zoom offers several different ways to connect. Now, presumably you're hearing me say this, so hopefully all is well. But if you have any issues at all, you can interact with us either via the chat button or the Q&A button down at the bottom of your screen. And speaking of Q&A, we'd love to take your questions throughout today's session. I know we have a lot of repeat webinar attendees. And you know that we do our best to handle questions if we can organically throughout the course of the webinar. So there's that Q&A button down at the bottom of the screen. Use it to interact with us. We won't make the questions public via Zoom, so no one but us can see the things that you're typing in there. It is often the case that we can't respond to all questions. And sometimes attendees ask that we keep the question private. But in those cases, we'll follow up with you directly, no matter what, either today or tomorrow. We'll get back to you. What else here? Let's see. You will get a recording of the whole webinar. Everyone always wants to know that. So you'll get an email with a link to things. And last but not least, when we're done, please take a second to fill out the short evaluation that will pop up on your screen. We definitely appreciate your feedback, and we use it to shape what we do and the kind of work that we're doing in the future. Okay, so let's jump in here. Hopefully it's not a surprise to you that we'll be talking about virtual events amidst the COVID-19 landscape, different challenges that companies are facing and how they're addressing those challenges in terms of HCP engagement. The voices you'll be hearing today belong to me and to Jacob Presson. We've worked with a lot of you in the audience today, so I won't belabor the introductions too much. You'll mostly be hearing from Jacob. He played a major role in the research that we're sharing, but both of us have been here at Cutting Edge for several years now as our FMB methodology has evolved. And in essence, our work bridges the gap between our internal data team and the implementation efforts of folks like yourselves as you set and deploy FMB rates and deal with HCP engagement challenges. Okay, what are we covering today? We'll start out by touching on the methodology, so we're all on the same page. Then we'll move into the specific findings, and Jacob will really take over at this point. We'll look at the status quo pre-pandemic, and then move into the challenges that have cropped up over the last year and a half or so. We'll look at event management and talk about how compensation has evolved, and then we'll look to the future. And finally, towards the end, we'll spend a quick minute touching on US specific findings. And of course, we'll handle questions at the end and throughout if we can. Okay, methodology, our first section here. We want to make sure that we're on the same page about where today's findings are coming from. So first off, we ran a survey. We used a data set of 59 survey responses. It all comes from life sciences companies. You won't be surprised to hear that the respondents were primarily from compliance and medical affairs functions. In terms of the geographic breakdown, nearly half of the respondents were in the US, another third or so were from Europe, and the remainder were from Latin America and the rest of the world. And there is a similar balance in terms of company size. And for our purposes, there's a nice distribution here because we get to see and we get to share with you what different types of organizations are thinking about as they have engaged HCPs throughout the COVID period. Okay, so now let's get into this mindset a little bit. Here we're all here joined virtually, of course, like we're doing so many things. And this is the first of our 2 polls that we'll be sharing today. And we're really just curious about where everyone is joining from. So what best describes your own current approach or your company's current approach to the balance of remote work and in-office work. And there are 4 options here. The spectrum goes from fully remote and fully back in the office. So we'll let folks share their responses. We'll give it a moment here. I can't let the results come in. Jacob, can you see any of those responses?
No, let's actually, looks like a lot of folks have had a chance to pop in. So let's take a look at the final results and see. So an interesting mix today. Looks like all told, about a quarter of people are in the office today. That's split about half and half between those who are in a hybrid situation. So you might be able to tell Eric is in the office today. I am joining from my home office. So yeah, I mean, there's all these challenges that we've kind of been collectively facing when it comes to our work environments, and some of what we'll be talking about today is how that ends up translating to the HCP engagement landscape. So I think with that, we'll go ahead and dive right in. And like Eric mentioned, the pandemic, it continues to evolve and challenge us, and really what we'll be spending our time on today is understanding how that affects HCP engagements and how the industry as a whole has been trying to overcome those challenges. So one of the big things that stood out as we reviewed the data was just how few companies had much exposure to running virtual events in almost any way. When I looked at speaker programs specifically, 49% of my respondents had done 0 virtual events pre-pandemic. And then suddenly, within months over the course of Q1 of 2020, almost everything had to be virtual. And even when you account for the decreased volume of events, because a lot of meetings were canceled, this is really an astonishing turn. And we've spoken with our clients over the years about virtual events, and it always seemed like there was some hesitancy over the effectiveness. They were unsure that HCPs would really embrace the technology. So only 1 in 6 companies were doing even 10% of their speaker programs virtually prior to the pandemic. And so it's really incredible that over the period of a month, all of these concerns needed to be set aside, and folks just dived right in. We'll get into how well those virtual events went here in a little bit, but I wanted to first look at some of the significant challenges that were created by the sudden shift, which really takes us into our next topic. And obviously top of mind in a predictable challenge is trying to get real engagement from participants. And that's especially when compared to the comfort of an in-person setting. And don't worry, I fully recognize the irony of talking about this in a virtual event right now, but we'll do our best. So overall, we do see that this was an occasional or frequent challenge for around 60% of the industry, but this doesn't really tell the whole story. In the US, engagement was not really considered as frequent of an issue. And this is in contrast with Western Europe, where over 80% of respondents reported the quality of engagements was an occasional or frequent problem. Another trend that we saw in the data was a pretty big struggle for smaller companies. And for the purposes of this survey, we defined this as those with less than $1 billion in annual revenues. This does correlate with a lack of experience with virtual platforms, but it could also be related to limited budgets at smaller companies that may have ruled out some more specialized engagement platforms. So really, this is never an easy challenge to tackle. It's such a sea change in how companies manage these events. And this is especially true for an industry that has for so long been focused on in-person contact for both medical and commercial communications. So one of the things that has always been true, but is particularly highlighted in virtual events, is the need to present compelling and useful content. And this is true from an engagement perspective, and we'll talk a little bit later about how this is also true from a compliance perspective. With in-person interactions, the personal touch might be enough to mitigate weak content, but that's really going to be quickly exposed in a virtual setting. So the first step is putting strong, coherent content on the table. The second step that you could take is to make sure that virtual event systems are in place that reflect the value you put on both speakers and attendees. Later in this webinar, we'll go a little bit deeper into the future of virtual programs, but I'll go ahead and give you a mild spoiler. They're going to be here for the long haul. So it's worth investing in a strong platform that's easy to use, easy to adapt to specific circumstances, and importantly, easy for your HCPs to interact with, both from a speaker perspective and from an attendee perspective. One of the other issues that we heard, and actually this came directly from one of our clients, was the question of verifying participant engagement. And here we do see some interesting variations between regions, like we did on the last question. So in the US, we really didn't see many companies reporting complications here, although it was a pretty significant minority who did. In contrast, 2/3 of respondents from emerging markets said that confirming participant involvement was a frequent or occasional issue. Now, when we talk about trying to resolve this, this is going to be mainly solved by improving your internal processes, and also just making sure that HCPs understand your expectations for them at virtual events. For those of you who might be sitting in a global compliance group, it might be worth spending some time validating the approaches and the processes that are being used by local business units, just to make sure that you don't have any trouble brewing. One of the most common questions that we get relating to virtual events is understandably the one of compensation. CEI focuses on working with compensation data, so it's something that we hear about a lot. And in general, we do see companies are broadly using the same compensation for virtual events that they did for equivalent in-person events. And even when I isolate the data so that it's specific to company size or geography, the results stay largely the same. To go a bit deeper on the chart that we're looking at here, we know that some companies publish an hourly rate or rates and then work out the total compensation for an event based on the number of hours the HCP spends on prep, travel, or the activity itself. In other cases, companies might spend or might publish a single flat fee for a specific type of event. So let's say, for example, $1,600 for a local 1-hour speech. So that'll have some built-in assumptions like 1 hour for the speech, 2 hours of prep, and 1 hour of travel. The goal of this specific question in the survey was to figure out whether virtual events are being compensated in a meaningfully different way compared to those equivalent in-person events. And of course, the challenge that we run into is that companies don't structure their payments always in the same way. Some may use a flat fee. And so even if a virtual event is paid at the same hourly rate as an in-person event, the lack of travel compensation or the lack of travel time compensation could result in a lower total amount paid to the HCP. Our findings do indicate that most of the industry does treat these two event types as the same, minus the travel component. Most of the difference that we see arises from how rates are initially published and not the actual underlying hourly rates themselves. So again, because CEI works mainly around compensation amounts, one of the things that I expected was to see a lot of pushback from doctors and other third parties about losing out on travel time compensation and that this might be a challenge for companies. In fact, a lot of them felt really comfortable standing firm. And I want to highlight some of my favorite quotes here from the survey respondents, especially the one gentleman who very bluntly said that those who demanded more compensation were flatly rejected, and a different speaker or HCP was found for the event.
All right, thanks, Jacob. Okay, so let's move into the next section here. What do these virtual events look like, and how effective have they been? In this section, we will dive into several details of event management itself, and that includes concerns about effectiveness as we've all moved into this virtual world. And we'll dive a bit deeper into that compensation topic we were just looking at, specifically looking at prep time and other adjustments that have been made during the course of the last 18 months. We'll also hear a little bit about audience concerns when it comes to these events themselves. So Jacob, take it away.
Thanks, Eric. So really, in the question we're looking at here, we asked respondents to rate the effectiveness of their virtual events on a 1 to 5 scale, with 1 being very ineffective and 5 being extremely effective. When we look at the data overall, we do see a really nice incremental improvement over time, comparing the pre-COVID before times, or however we want to refer to them, with our current during COVID experience. It's also really impressive to me that even during frankly, the chaos of the pandemic, lockdowns, new working environments, other pressures, the effectiveness of virtual events increased significantly across the board. We also asked respondents to provide a projected estimate of what the post-COVID world will look like with regards to virtual event effectiveness. Some of us in the US are getting, or we thought we were getting, a taste of what a post-COVID world might look like, but I fully recognize that all of our experiences on a global scale or even within the US are going to vary. The good news is that we, even as we hopefully leave the pandemic phase of our COVID world behind, we do see the improvement in virtual event effectiveness continue to improve, albeit at a slower pace than during the pandemic. And to be honest, this is reasonable. My main takeaway here is that the virtual effectiveness, or rather the effectiveness of virtual events, has increased over 30% compared to pre-COVID times. And that, of course, is going to have a marked impact on how companies are, and how the industry as a whole is using virtual events going forward. We also received some questions from our clients around recording virtual events and how the licensing specifically for potential rebroadcasts works. On a global scale, around half of events are not recorded, and the remainder are split pretty evenly between recordings that are for internal or compliance reasons versus events that were recorded for the purpose of rebroadcast or reuse. And so, as with one of our previous questions, there's some kind of interesting geographical variations here. The US in general has very little history of recording virtual events. Almost 3/4 of them are going completely unrecorded. And this is really in contrast with other Western countries and emerging markets. And while we're talking about Western markets, there does seem to be a bigger emphasis on recording events for rebroadcasting. Our thinking here is that this might be due to the cost-effective nature and easy flexibility of rebroadcasting in markets where KOLs might be sort of widely dispersed and where travel costs might be higher. One of the other things that came up was a few clients asked us about the licensing for these recorded events, and especially if you are rebroadcasting an event, whether or not a royalty payment might be appropriate to HCPs in these recordings. I was honestly a little bit surprised to find 100% of our respondents indicated that the general contract that they have with the HCP will give them total ownership, and by them I mean the company running the event, total ownership of the recording. And so no royalty or premium is due for rebroadcasting a recording. That recording is the sole property of the company who ran the event. One of the other things that we wanted to talk about was prep time for a couple of different types of events, and also understanding the potential variation when we're talking about in-person versus virtual. The overall trend here is that really in keeping with the overall compensation amount, in-person and virtual events are treated as generally the same. There's really no difference in the number of preparation hours between comparable events. I will note that our data continues to show that prep time is paid at the same hourly rate as the activity itself. That's something that we've covered in other webinars and continues to be true even in the virtual environment. So one of the benefits that we see here of keeping prep time the same for virtual and in-person events is that you end up with consistency, and that will hopefully help the HCPs when you're talking about compensation for events, and it avoids adding another layer to the compliance process. One of the things that I want to pause to talk about here is that there's an interesting trend of ex-US markets, and I'm talking specifically about Western Europe, are averaging a higher number of preparation hours being paid out, about half an hour more on average for each event type. I say that, but it's one of the few clear trends to come out of the data. There really is not an industry consensus on how to manage preparation time in the number of hours that are being paid. While most of the answers that I received were kind of in the ballpark of the averages shown here, there are some companies paying twice as many hours for a long speech and others as little as a single hour. So I want to be clear, this data shouldn't be taken to indicate an industry norm per se. Now, one of the interesting elements of this shift towards virtual events is that we've all been along for the ride. All of us together here are experiencing a virtual event together. And so with that in mind, in the survey that we ran, we asked respondents about the challenges that they encounter during virtual events. What we're looking at in this table is the percentage of respondents who indicated that a given challenge presented a moderate or severe impact on their personal experience as a virtual event attendee. So the main standout here that's affecting people is the lack of interaction with other attendees, which is certainly understandable. Even though there are chat windows and a Q&A panel, and I can actually see a couple of you have already been using that, which is awesome, so thank you. All of that doesn't really replace the in-person interaction that you get at a conference or at a meeting. And in addition to not being physically with other people, it's quite easy to get distracted during a virtual presentation. I can attest to that. My office looks out the window and I'm constantly looking out at what's going on around me. So returning to the theme from earlier today, and specifically those challenges of trying to concentrate in a virtual environment, it could be down to the platform that's being used. It's important to make sure that what you have is something that's easy for users to engage with, to feel like they are getting a comprehensive user experience out of. And just one last note on this topic, an interesting finding that we had here was that respondents in emerging markets seem to have had more experience with virtual events and therefore don't seem to have encountered the same types of problems with distraction or concentration.
Great. Thanks, Jacob. And before I introduce this next section, I do want to address one question that came up, and I think I published my response to the whole group. But the question was about whether these results would be shared, whether the slides would be shared, because there are a lot of numbers and a lot of things to parse and think about. So the short answer is yes, that those responses will be shared. We'll be sending out the slides after the webinar. So keep an eye out for that. If you don't see them, get in touch with us and let us know. And of course, we're always happy to talk more about what we found and dig into some of these findings a little bit if something really catches your eye. Okay, all right, outlook, this next section, where are we going? This is a topic that I think everyone is thinking about in the broadest sense and not just in terms of HCP programs, but where are we going? So in this context, we asked respondents for their views of the future, and we specifically asked them about topics like travel for their programs and where they think that's going. And we also took a look at the balance of in-person versus virtual events. So across all these kinds of topics, where do we think the industry is headed?
So we'll start off with sort of what we saw when we asked respondents about the issues and the factors influencing a return to in-person events. And when we asked about this, the strongest trends that we saw included the need to reestablish in-person contact and the willingness of speakers and attendees to travel. And this is along with kind of understanding the local and federal government guidance. The percentages that we're looking at here are the number of respondents who indicated that a factor is a moderate or significant influence on their decision to return to in-person events. So unsurprisingly, the return to normalcy, which we always seems to be 6 months away. I think that's going to be among our respondents. It is the single largest factor among respondents. Everybody is eager to return to that in-person contact. We did see that concerns over willingness to travel are much higher in the US than in emerging markets. And this is in line with the overall trends that we saw in emerging markets, where aside from the need for in-person contact, there are a few major factors influencing their decision-making. And so, like Eric mentioned, we did also look at travel standards and how companies might be adjusting going forward. And the short answer is that the general SOPs and practices around travel are going to be largely unchanged. But it's the volume of travel that is going to drop significantly as virtual events become a much bigger part of companies' toolkits and as they get more comfortable using that. On the other hand, the significantly lower overheads that are involved with not having to book travel and venues, that's really going to ensure that virtual events are a part of the mix for the long haul. And that takes us to sort of the big question of what exactly normal is even going to look like once the pandemic is behind us. And the answer is a relatively unexciting, but kind of predictable 50-50 split. And that does vary a bit by company, but that's generally the average that we saw. So as discussed earlier, there are major benefits to meeting HCPs in person, and folks are eager to return to that. But companies have learned a lot about how to conduct virtual events successfully, and along with the cost savings that I mentioned on the previous slide, there's a really strong business case for keeping them as a part of the mix. And with a potential return to normalcy, hopefully on the horizon, and like I said, it feels like that's been on the horizon for a while, with multiple false dawns. I would be interested in sort of tapping your collective experiences for just one more poll question rather. And so what we're interested in understanding is sort of at what point do you anticipate at least 30% of your events taking place in person? And it's possible that this is already the case, but if not, do you think that'll happen in the first or second half of next year, or are things too unpredictable and you're looking at 2023 and beyond? And while these responses come in, we did a very similar but kind of informal survey on this topic earlier this year among our clients, and over half of respondents had indicated that they thought a return to at least 30% in-person events could happen as soon as the second half of this year. But it's worth noting that that was before the Delta variant really arrived in the US and in Western Europe. And so I'm curious to see how those results hold here, albeit with a slightly different audience. And so I think we've had a good chunk participate. And so, yeah, so it's interesting, you know, that optimism from earlier this year. We've gone from over 50% to now right around 15%. And it looks like around a plurality of folks here see that coming in the first half of 2022, with another big chunk not coming until the second half of next year. And so, you know, like certainly with all of the uncertainty that we have going on, and this is something that we've talked about internally, it's a significant stressor professionally and personally. And so you know, this is just kind of reflective of how hard it can be to sort of plan things out in the current environment. So I do have one last topic before we go. And this is going to be specific to our American audience and the OIG Fraud Alert that was issued towards the end of last year. So for those of you who are unaware, in November of 2020, the Office of the Inspector General, the OIG, who heads the Oversight Division for the US Department of Health and Human Services, they issued a memo indicating that their office was skeptical of the educational value of some speaker programs and highlighted some potential issues with programs where educational content might be lacking, venues are extravagant, and or speakers might be repeatedly selected to present or attend the same content over time. And part of actually what prompted the fraud alert was that the OIG noticed how well a lot of virtual events were going, that a lot of this content could be effectively communicated in a virtual environment, which led them to question the need for in-person events that may be accompanied by extravagant meals, that might be accompanied, that might be in a particularly fancy location. And so we wanted to understand the reaction to this fraud alert. While the OIG's jurisdiction obviously is limited to the US, I do want to bring this up because it might be a leading indicator of what other regulators around the world are also considering. So, as one might expect, it's the question of it's the issue of venue selection that is the most heavily impacted factor, with over half of respondents already implementing changes as to how venues are chosen. In addition, the total number of in-person speaker events has been trimmed by a third of respondents, and another third are considering a decrease. And then in response to the guidance, companies are also looking at the number of events per HCP to make sure that each speaking engagement by an HCP or one attended by an HCP contains new and relevant information for their practice and for their healthcare. So one of the things that we've seen in response to this, the US industry group, PHRMA, did recently update their guidance did recently update their guidance in response to the OIG alert. So in August, they started recommending against serving alcohol at HCP events. And they also recommended other steps to ensure compliance. So we do have a question come in about the number of responding companies that's specific to this US slide. If I remember right, I think it was about 22 respondents who pitched in here. So not quite the full 55, but of those respondents who were able to answer for the US. So we feel like this is somewhat representative. A couple of the other things that PHRMA wanted to talk about was sort of understanding the need to make sure that both attendees and speakers at these events are seeing new content. The issue of repeat attendees is something that came up quite a bit in the OIG slide, or in the OIG Fraud Alert, and it's something that that pharma is also looking at. So, with all that being said, that's all that I have for you. Thank you so much again, everybody, for joining us, and I will hand things back over to Eric to close things out.
Thanks, Jacob. Okay. Yeah, Jacob said that's it. Thanks everyone for sitting through yet one more virtual event. We tried to keep it short and to the point. We do welcome your questions, so keep them coming. We have a queue of them that we'll address in just a moment. Before we get to them, again, you'll see an evaluation pop up as soon as we end today's session. We really do appreciate your feedback there. We look at it, we read it, we discuss it internally. So please feel free to share your thoughts. We appreciate it. You will receive a follow-up email with links to today's content. And lastly, many of you are aware of this, but we are now in the midst of our annual FMV data collection process. This is where we collect rates for our annual FMV database, the one that covers the globe. I actually think that a lot of the folks in the audience today have already submitted rate cards, but if you haven't and you're willing to get involved, this is clearly something that strengthens the defensibility of rates for all of us. So keep an eye out for contact on that front, or feel free to reach out, of course. Okay, now questions. And again, remember, if we don't get to yours, we will be following up. I'm going to be keeping an eye on the time and hoping to get us all out of here before the hour is up. But question number one, and most of these I'll be throwing over to Jacob. Do companies pay extra prep time for HCPs to learn a new platform? So this is a technology question, an acclimation question. Jacob, have we seen anything on that front?
Yeah, so it's not unusual, especially for the first time that an HCP is using a new platform, for there to be either a specific training session for which they might be compensated for their time, or an additional amount of prep time added to sort of their first event in which they interact with the platform. We don't have hard benchmarks on this. But that, based on what we're hearing from our clients, that doesn't seem to be an unusual process.
Mm-hmm. Yeah, and I can share it. Like you say, Jacob, it's entirely anecdotal, but we've definitely talked with teams who are adding some hours up front, but of course that doesn't persist. And theoretically, everyone is growing more and more comfortable. I mean, heck, just to have meetings now, we're all fairly comfortable with Zoom and other platforms. So it may enter the equation, but it's not something that's permanently increasing prep time or engagement fees, at least as far as we've seen in the data so far. Okay, our virtual events, this is a good one. This is a good one for us. Are virtual events being included in rate cards? So are we formally seeing a breakout of virtual programs in the rate cards that we review?
So pre-COVID, it was very much the exception. We would not often see a virtual event included in a rate card. I could think of a couple of examples, but increasingly, as we have conversations with clients about how they are choosing to deploy their data, we are seeing rate cards, or we are seeing virtual events increasingly a part of their deployment process. So whether that's a specific line item in the rate card, or a specific section of the SOP that's dedicated to virtual events, we definitely are seeing that. And I think that's kind of reflective of the data that we looked at early on, where prior to COVID, almost half companies had never done a virtual speaker program. So there just wasn't a need. But now, certainly, I think we are going to see virtual events getting more of a prominent mention in rate cards and or SOPs or other documentation.
Yeah, and Jacob, to that point, going back to the beginning of the pandemic, if we can all remember back that far.
No, I've forgotten.
Yeah, especially for the first 6 or 8 months or so, seeing a divide, kind of a bifurcation of companies between those who did have virtual events included on their rate cards. And, they had to adapt, they had to adjust, but it was a little bit of what's the big deal? We're prepared for this. We already have rates indicated, and it's really, we're just switching the engagements themselves. And there's some explanation to the HCPs, but we're prepared for this. And then on the other side were the organizations who didn't have it outlined. And there were a lot of questions coming from those companies about how to quickly shift, quickly pivot. And like you're saying, by and large, we're going to see a lot of those organizations, including explicitly virtual fee packages in their rate cards going forward. Okay, let's see here. This is okay. Are you seeing rate changes as a result of the pandemic? So I take this to mean, are companies adjusting their actual underlying rates, or at least that's how we can interpret this question. I know we talked about flat fees and hourly rates at the top of the webinar, but in general, are companies adjusting rates? What are we seeing on the rate front?
So there's not really been a significant shift. Now we are in the process of collecting data, like you mentioned, Eric, for our 2022 data set. And so that is slightly an open question, but my expectation would be that the underlying rates aren't going to change significantly. Now, what we might see is that, as demand for certain individuals' services does change, those rates might shift. But that's more of an indirect impact, more of an indirect consequence of how the pandemic is changing industry priorities, and not really a fundamental shift in how these rates are assessed. So I don't expect to see a lot of change in that area.
Okay, and this isn't about compensation specifically, but it is about the form and format of some of the meetings, and this is anecdotal as well. But we were just talking with someone, I think it may have been on a panel at one of the recent conferences. We're talking about how they had changed up what they're doing in the event itself, in the virtual event. And they talked about making some adjustments there. So intentionally capping audience numbers to ensure that there's a higher likelihood of interaction among the attendants. So, you can't hide in a crowd as much if there are just 6 or 8 or 10 participants in the program, as you can if it's a much larger group. And they also talked about taking more frequent breaks, including poll questions or sort of forced audience interaction much more frequently than they had in the past. So whether or not the rates themselves change, if we see a shift there, we're certainly seeing a shift in how the programs themselves are run, at least among some companies. And I'm sure everyone has war stories about what they've seen work, and perhaps more entertainingly, what they have seen not work whatsoever. We've heard some of those. Okay, I'm going to try to get us out of here by 15:15, but here's a last question. And Jacob, I know this is something we've talked about internally, and I don't think we have hard data on it, but I think you and I can speak to it based on the conversations that we've had. And it touches on travel, and it touches on disruption for the HCPs. So, and this is a bit of a preamble, and I apologize for it, but we have seen companies talk about how cross-border events are more likely now, or they're a little more possible because travel is not necessarily part of the picture. So you can bring in HCPs that you may not have before. And so here's the question is, have we seen companies pay more for events in which there's a significant time difference? So maybe your panelists or your speaker are in a completely different time zone on the other side of the world, and as we all have done, I think, they're joining a meeting at 3 a.m. or 4 a.m. In order to address an audience. So there is a disruption there. And like I said at the beginning, sorry for the long question, but Jacob, I don't know that we have hard data here, but can you take this one? Is there anything you can speak to on this front?
Yeah, so we've talked about this with a couple of clients, and it really at this point in time seems to be handled on an ad hoc basis, where if there is a particularly strong case for it, that hypothetical 3 a.m. meeting, which is very tough, there might be sort of an additional fee or premium paid. But I don't see that entering into SOPs, and certainly not on rate cards yet, because it doesn't seem to quite be coming up often enough. There is some precedent for at least acknowledging and accounting for that extra burden on an individual who is waking up extremely early or who is giving a midnight speech for an audience in a different time zone.
Great. Okay. Thanks, Jacob. Bit of a curveball there, but I appreciate you handling it. Okay, everybody, that's it. We're going to let you go. Thanks again for joining us. We really appreciate it. Stay tuned for a link to these slides, and please continue to hit us with any questions. We really appreciate it. Have a great day. Bye.